for the last 2 years that what we saw during COVID wasn't so much a public health campaign as it was a profit machine. A profit machine for the big pharma companies who made billions and billions of dollars off of a vaccine that they did not adequately test, about which they did not adequately disclose health risks. They made out like bandits, though. I mean, this is great for them. All of the public health problems get offloaded onto other people, namely the American people. All of the costs get borne by the patients. They don't have to do anything, and they get rich off of it. I mean, let me just ask you, in your professional opinion, did these companies like Pfizer and Moderna, did they adequately study and disclose any of the risks that were associated with these vaccines before they were forced upon the public?
Well, I think there was a lot of collaboration, and it was stated openly. The government, the FDA, the CDC were working very closely with the drug companies. So this wasn't a normal sort of development of drugs that we see in history. So a lot of the stuff that the companies were sort of got away with it, as it were, was with the consent of FDA, who generously interpreted regulations concerning certain types of testing, genotoxicity or lipid nanoparticle testing or biodistribution or whatever it is. And in one of the attachments in my testimony, there's 248 questions that detail that very specifically. So while the drug companies ultimately are responsible for their product, maybe they should have taken the view of, well, even if the government says we can get away with it, we're not going to. So there were clearly things that they knew, and they over generously interpreted cancer studies, genotoxicity studies, biodistribution studies, and
A dramatic moment unfolded during a Senate hearing when Senator Josh Hawley launched a sharp critique of pharmaceutical companies, government regulators, and the handling of COVID vaccine development. In a tense exchange with expert witnesses, Hawley argued that what was presented as a public health response became a massive profit engine for some of the world's largest drug manufacturers. His questions focused on transparency, vaccine safety disclosures, government involvement, and whether Americans received the full story during the pandemic. Let's break down the key moments from this explosive hearing.
Abuse of public trust, given that they had this sweetheart of a deal, all the marketing was done for them by the government. That is a particularly egregious example.
Let me just ask you if you've encountered other instances where adverse event data was downplayed or disregarded or even outright concealed by either the manufacturers or public health authorities in a way that had the effect of protecting corporate interests over patient safety.
You mean outside of COVID?
No, in the COVID context. I mean, you've named a couple. Are there others that we should be aware of?
I mean, I think everything, it's altered. The question is, even though we've been discussing the Bayesian data mining that the FDA conducted, we don't know what systems the Pfizer and Moderna were using. They also have a responsibility for pharmacovigilance. So I think a valid question is to ask, what were they finding? What systems were they using? Were they adequately an understanding of the limitations of those systems, and to what extent were they reporting them to the government? So I can't give you more specific examples than what we've already seen.
What reforms would you recommend Congress pursue to ensure that this sort of future public health emergency, the cases like this that we saw in COVID, that pharmaceutical companies, private companies are held accountable for adverse events? They're not getting the sweetheart deal that you've been describing.
Well, I think there has to be a greater separation between the government and the pharmaceutical companies, understanding that it was an emergency situation. There had to be an element of collaboration. So there is something there, but there has to be some separation. But going forward, specifically in the subject matter of what we're discussing today, there are some major reforms of VAERS that have to take place. In terms of making sure the data is properly collected. There's a person called Albert Benavides who's done a great job at documenting that. The companies should be required to be using the modified Bayesian methods. The PRR methods should also be used with caveats. And there has to be adequate oversight of exactly how these signals are going to be implemented.
Like and subscribe for more political showdown.